Well, here we are live on Dr. Kris. Got a little technical difficulty happening at the moment, so here we go. So, those of you that have been joining us, we have been talking about age management, peptides, and how you can start to apply certain thought processes and helping get your cell healthy. And here's Dr. Kris.
There we go.
Dr. Kris, you're back.
I'm back. I don't know what happened there, but I'm back. Hi, Steve. How are you today?
I'm excellent. So it's just two guys trying to figure out how to run this technology stuff. So, Dr. Kris,
I keep my wife in the other room just in case, because as you know, I'm not technically savvy when it comes to computers. So I just figured that one out on my own. It said click this button, so I got it. I did it. So we're good.
Well, good. We're proud of you. So, yeah, welcome back. So, Dr. Kris, he's the physician with the research clinic in Weatherford, Texas. Dr. Kris we've been conducting these on a weekly basis, but the last 2 weeks, Dr. Kris has been off learning all sorts of cool stuff about what the future of peptides holds, new treatments, how people are using certain things now. So, Dr. Kris, welcome back. We missed you.
Yeah, Steve, it's good to be back, actually. It's just been catching up over the last week or so, but Crisanta and I, my wife and I, went out to Scottsdale a week and a half ago and spent a couple days, 3 days out with the top peptide physicians in the country, in my opinion, out at Dr. Seeds SSR training, which was 2 intensive days of training about the neurologic and neurodegenerative conditions. It was fantastic. We learned a lot. And as I was telling you, we have another one coming up in about 5 weeks. It's all, athletic performance based, which I'm really, really excited to go to as well.
Yeah. So wanted to start off and just go, the things that the whole intent of these discussions and talks are to empower you with the language to talk to your physician about other options that you can explore. So these conversations are intended as educational, and we, of course, always suggest that you consult your physician before changing your medical program. But we wanted to give you the language and the knowledge so that you could have a better conversation not only with your providers, but also the providers that watch this. We're helping you understand how your patients are thinking or the questions that they're asking. I'm just a layman. I'm really interested in this, and Dr. Kris is not only my client, but he's a friend, and so I get a lot of these out of these conversations. So, Dr. Kris, what was like one of the big things that you didn't expect that you learned in this last get together?
Well, I think that it's nearly the simplicity of some of these things that, Dr. Seeds is someone I've been training under now for about 2 years. And I was talking with him. We had some time together at the pool on Sunday after the conference was over, and we're just kind of talking. And I let him know how the first time that I listened to him, I wasn't quite so sure I was buying into what he was selling. It was so different than anything that I'd ever thought about. Like, okay, it can't be that simple, and so but he's a dynamic speaker. So if nothing else, he got me to come back to the next conference. And as I started to listen, and I'm still, as I tell my own patients, we're all learning here. That the great thing about peptide therapy is that every physicians should always be learning, but we're really learning when it comes to this, because this is an evolving field, and what we can do today, we hope we can do a whole lot more in 6 months and a year and so on. But so this one was all about neurologic, which is one of the most common discussions I have with my patients, other than I don't feel good, I need more energy, I need to sleep better, the common things. But once we get past that, I find that probably one of the biggest complaints I get is either A, I'm really afraid of the function of my brain as I age, or B, I feel like my brain is not functioning as well as it did 10 years ago. Or C, kind of the same thing, piggybacking off that. I think I've acquired ADHD. I'm now 48 years old and I can't, do mentally what I used to could do. And so I deal with this a lot. And so I was really interested to go to this conference for specifically that reason. And I think the other 31 physicians were as well, because there's 32 of us that attend these live seminars. And after Dr. Seeds did his presentations, and after the first day, which was 8 hours, he broke it down. And basically everything that we've been talking about in our podcast is not just specific to one part of the body. The brain is no different. It's just the pathology, I guess I would say, that can occur with cellular communication breaking down or cellular efficiency breaking down can ultimately lead to these different conditions, dementia, Parkinson's, multiple sclerosis, and these things. And so I'm not trying to tell every physician out there or provider that's listening, or even patient, that it's all this simple. But Dr. Seed's point, I believe, is that at the end of the day, is if the cells communicate, if they're more efficient, at the end of the day, it has no choice but to help us at the end of the day.
Wow.
Maybe you're not going to cure someone with Alzheimer's, but you're surely going to at least help them. And Alzheimer's, dementia patients, Alzheimer's patients specifically, they don't have a whole lot you can do for them these days. You can throw a couple medications at them that slow the disease down, but it doesn't actually make them think better or do better. It just slows it pushes the endpoint out in time, as all the medications do. That's it. That's the only hope you can give a patient, is maybe I can make your brain function be a little bit further out. And that's not okay with me. That's not what my patients are looking for. And so anyway, it was just really intriguing to hear it broken down in that simplistic of a way.
I don't think you know this, but there was a time in my life where I took care of a gentleman that was a member of an extended family, and he got Alzheimer's.
Mm-hmm.
And all we had was a certain medication that slowed it down, and it calmed down his frustration with the deterioration of his not being able to recognize who we were, or it was really, it's a really evil disease. But what I recognized was when you had a very structured, predictable environment, he fared a lot better when there was no surprises, when the environment was calm, when he got his 8 glasses of water every day. It was amazing. Right. It was so amazing. But he even forgot how to swallow.
Yeah, absolutely.
And you would say, George, swallow the water. And he would hear it, but it got garbled before it got to where his brain would tell to swallow. So what I learned was, if I go, hey, George, what's your name? And he'd swallow and go, George. And so I learned how to manage around some of the frustrating aspects by relying on that old pathways, mm-hmm. and not new pathways.
Yeah. I mean, I do tell my patients all the time that we all should be fearful of cancer and do our prevention and stay healthy. But the one that scares me the most is dementia. Mm-hmm. Luckily, familially, I don't have any dementia in my family that I know about. My wife has a tremendous amount, and I know it really concerns me for her as well. And so it was nice to kind of hear some of these different ways to possibly not only help some of these people who have these conditions now, to augment whatever program they're doing. Typically it's Aricept and Namenda for Alzheimer's. Mm-hmm. And then everything else that we give an Alzheimer's patient is just to calm down a symptom. Here's something to make them not anxious. Here's something to make them sleep. We're not actually really fixing them. We're just giving them something that sedates them or whatever. But it was really nice to see some of these augmented, to at least give some of these families some hope that there's something else that can be done that maybe would help their loved one. But then also some things that we can start doing ourselves as 40 something, 50 somethings to, hopefully as well lower our chances of some of these neurologic conditions down the road.
Well, let's talk about those because I'm always curious. Of course, people say, "Hey, you need to keep active. You need to use your brain." Those things make sense to me, but I don't know what I might be ingesting. I don't know what I might be doing that could aggravate or increase my risk of developing that. My grandmother had that as well.
Yeah, I think one of the things that stuck out to us, and this is not peptide based, is Dr. Seeds was talking about simply glazed cups. So your average coffee cup, because most of them all come from outside the United States. And if you actually test them, they all have a lot of cadmium and lead in them. And so that's actually one of the things that's thought to be adding to some of this increased neurologic disease that we have. And so I don't drink coffee, although I should, because coffee itself is good for you, just not the cup it's in. And so it's funny, Crescento, my wife, on the way back was like, okay, I got to get rid of all the coffee cups. And so I got to go to Yeti cups or, the actual throwaway cups. And it's funny, just environmental factors, just like that, small things. But you're right. I go back to it over and over. I still believe the best thing that we can all do for ourselves is eat right, exercise, intermittent fast. Those things are crucial for everything. We're helping every organ system by doing that. The intermittent fasting is tremendous for our immunity, for our overall health. We're not going to spend too much time on it today because we've hit it a few times. We, of course, pounded how important ketone esters are. Dr. Seeds now has a actual paper that's been published on ketone esters along with COVID, with some tremendous data there. And so, the ketone esters, again, really, we've been promoting it for the positive aspect on the brain, the instant fuel for the cells. There was just a lot more discussion on why that's so important. So, we're still really loving the ketone esters. Really and truly, when we started getting into the peptides, the TA1 was still very important, of course. And TA1 is the modulator of the immune system by creating more T cells, B cells, macrophages that decreases with age. And we've kind of discussed that one quite a few times. And it's made within our thymus gland in our body. And it's a great addition to any wellness program for patients, in my opinion. Really, no contraindications. But really, overall, the immune system is absolutely tied into our brain function. Again, all of this goes together. It's just a circular pattern. But we discussed it on our last one a little bit. We really, in depth, talked about cerebral lysin and how important that peptide is. It's a neuropeptide, and just how important it is for, improving brain function itself, how you can use this medication in, closed head injuries, CTE, Alzheimer's patients. You can actually inject it locally into pain areas and actually get it to help with that. But that's a whole different topic. But, the physicians that were there that are using cerebral lysin and because what's great about this presentation is there's always a provider or two that's primarily what they do for a living. I have a practice I feel is more wellness based. I see a lot of patients. Most of my patients are just like you, Steve, that are overall healthy, wanting to stay healthy, maybe get a little healthier, but mainly wanting to maintain function. But there's a lot of doctors across the country that truly specialize in sick patients, and some of them specialize in simply dementia, ALS, MS, Parkinson's. And so it's really cool when you're able to get together with a couple of those docs and share their experiences, because they probably treat more of this in a week than we'll do in 6 months, just because of that's all they do. And so that's really awesome. But the cerebral lysin, is a fabulous peptide. The only real issue, and this is more to the providers that we're having, is that it's really hard to source it these days. It's actually obtained from a pig brain, believe it or not. And just today, I've been trying to find a pharmacy that can get it for me. And as of today, everybody's out of it, but because it kind of goes along with the pig harvesting season, believe it or not. And so, but they're all saying in 4 to 6 weeks we should be good again. But yeah, we discussed cerebral lysin at length. It's just like I said, we discussed it a little ways back. But the other thing that we kind of started discussing, and I thought this was really an interesting topic, is you were talking about doing different things to keep your brain function going. And Dr. Seeds was just really pressing on us that at our age, we should, it is doing like little mind things, but it's like trying to learn a new language or go out and try to play a new instrument or something like that, something that's totally out of what you normally do. And that's how you really preserve that brain function, is by challenging your brain. If we just try to do more of what we do, that doesn't really work. It doesn't unlock any different brain pathways or any of that sort of thing. And there's some studies out there that maybe the apps don't really work that well on our phones, that really it needs to be like the good old fashioned, using your hands and a pen. That's where some of those brain teaser books are probably better than the apps for that. But we also discussed the one that I've been using a bit in my practice, and I think I'm going to start using more, is VIP. And it's vasoactive intestinal polypeptide. And it's the good thing about it is it's a nasal spray. So, so many of our peptides are injectable. We have a few that are oral, but most of them are injectable. And sometimes patients, it really doesn't hurt, but sometimes patients aren't so hip into, doing injections. So the fact that the VIP is a nasal spray, I thought was a really positive thing. And it, along with the other peptide that I was going to discuss, dihexa, which I don't think we got to last time, are two that are kind of used for, VIP can be used for the GI system as well. It actually increases blood flow to the intestinal tract. So you can actually get a lot of benefits with the gut with VIP, but it also was really good for the brain. And so is dihexa. And both of those can be used for, like the patients that think that they have ADHD, that feel like their higher level brain function is starting to suffer. You can rotate those. Like it was a lot of the practitioners that were there were on dihexa actually a week prior to coming to the conference, because even though this is what we do, this was going to be a higher level of learning. And, it's, oh God, do you remember that movie? It had, you know which one I'm talking about, that had, he took a pill or whatever. And
it made him smarter.
Yeah. That's kind of how you think of dihexa. Dihexa is this, this peptide that works through angiotensin 4 that unlocks kind of like the higher level of learning for short periods of time. But like Dr. Seed said, it won't work though if you just try to take it and then do your normal job. That you have to, try to do, like I said, try to learn an instrument or try a new language or go to a conference that really, really challenges your brain. That's how you actually notice the difference with it. And so I just thought that was a really, really interesting concept, because that's not how I've been using it in my practice. I've been using it just to help people, and I've seen responses with it. But then when you start realizing, oh, that's the key. All right, higher level of learning. That's where people seem to really see the benefits of it.
Is this how I have it spelled? Is that correct?
That's correct. Yeah.
And it's just VIP, like very important person?
Yes. VIP stands for vasoactive intestinal polypeptide. So VIP for short. Yeah. And that's the nasal spray.
Okay. So let's talk about that dihexa a little bit more. What's it doing and what's it impacting?
So it actually, it's, from my understanding, its main studies have been with Parkinson's, and it's actually shown a good effect with Parkinson's patients to actually increase their level of function. And it works through the angiotensin-renin pathway, which is a pathway in the kidneys, but that specifically helps with, believe it or not, it helps modulate and improve overall brain function. And so that's originally where it was kind of used, has been with those Parkinson's patients, but then it's now spread out and you're seeing it in just all types of neurologic disease or even prevention or just higher level of learning. Very well tolerated. That's the other good news, as all peptides are.
So that would be, let's talk about the situations where you would recognize and, excuse me, and recommend that. Is it just like I want to think better on my feet while I'm learning this new language?
So I think all of these are kind of like we've always discussed. I would think of VIP, dihexa, even maybe cerebrolysin as things that I'm going to pop in and out of a person's life.
Mm-hmm.
So, like you would not use typically like cerebrolysin indefinitely.
Mm-hmm.
Most of the time cerebrolysin is used for 30 to 45 days. I think that dihexa is the same. Typically, most people use it for about 30 days at a time. So I think in an average person's life, let's take a physician's life, I think that like I would benefit from it personally. When I'm trying to learn these different pathways, when I'm trying to get out of my comfort zone, I think dihexa would be a great benefit to me. And you might pick your time that you use dihexa based off of where you're trying to take your learning at that time. But if you're kind of a person that's always studying, always researching, I think that that's where I would then say, okay, let's do VIP for a month or two. Let's see how we do. Because I do believe, and what I've seen with most peptides is that long-term, you want to kind of rotate them in, rotate them out, because you will get, in my opinion, they will not work as well if you just continue to use them nonstop. Although TA1, I think, is definitely one of my exceptions to that rule. I use TA1 all the time.
TA1?
Thymosin alpha 1.
Okay.
Yeah, people ask me, what's the one you use all the time? For me, thymosin alpha 1. That's 0.5 twice a week, indefinite. I have no thoughts of coming off of that one. It just has too many positive effects. It's not going to down-regulate anything, so I'm good with that one. But basically what we're kind of talking about is just getting patients and providers comfortable with what is out there.
Mm-hmm.
And then the provider themselves, and as we're saying, we're not prescribing anything for anyone. We're just saying, hey, here's some different products that are out there. It's going to be up to the patient and their provider to come up with, what is the best way to go. But I'm falling more and more into that category of let's do this one for a month, and then let's do this one for a month. Maybe let's take 1 month off. Let's just see how we do, get patients' experiences, because I think your experience with each peptide is going to be different patient to patient.
So we're cycling these because I think of it as signaling. We're wanting the cells to communicate better. And so we're sending these things to get the cell to communicate some message and start maybe a cleanup process or boost some other aspect. Is that what I'm understanding?
Yeah, I think that's pretty spot on. And every one of the peptides works in slightly different ways. And so you kind of want to hit, I like to keep everything very simplistic. And I always say you kind of want to hit everything from a different angle if you can.
Mm-hmm.
And so we just don't want to pound one pathway the whole time. And I think that's why you want to switch from one peptide to another, so that you don't so that you become desensitized to it, so that you don't stop seeing effects from it, but that you also then with patients can try different peptides and see what works best for that patient as well. But if a patient says, oh my God, cerebrolysin changes my life so much, you should get back to a baseline and then be able to maintain that baseline without the cerebrolysin for at least a few weeks to months, and then you can rotate it back in. Again, many of the peptides don't need to be used indefinitely.
Right.
TA1 is the major one. Sometimes we'll use our growth hormone secretagogues for extended period of time because we're looking for certain gains. But a lot of these, and that's what I think is going to start separating peptide providers, it's one thing to just prescribe 3 or 4 peptides and here's how you do it. I think it's what's starting to separate peptide providers is having different peptides that they're comfortable with, and rotating these peptides and knowing how to rotate them, and sitting down with a patient and kind of going through their history and kind of figuring out what works best for them is pretty important.
So last time we spoke, we talked about cerebrolysin, Selank, and Cmax in a cycling manner as well,
Mm-hmm.
correct?
Mm-hmm. Yeah.
So
Go ahead. No, you go ahead, Steve.
Well, people think the default mindset of someone, here's a prescription, you take one a day from now on,
Yeah,
or
here's your Lipitor. Take it
yeah.
every day.
And so I think we naturally just think we're going to take these every day. What was really interesting to me was like some of them you're just going to do an injection once a year or
Mhm.
once a month or something.
Yeah, like Epitalon is one that I use for anti-aging that we use every 6 months, you know. So, and there's different reasons for all of these. That's why this is a very precise form of of health, wellness, if you want to call it that, because you want to really specialize for each patient their peptide program, and some patients are really into it and really want a heck, I can't tell how many times my patients come to me and say, hey, what about this one? I read about this one, and that's pretty cool. Sometimes I'll agree with them, sometimes I won't, but I think it's pretty cool whenever they've actually done their own research. But yeah, it is a mindset that's kind of hard to get past with some patients, because we're so trained from birth to like, here's your pill now for the rest of your life. Now take this, because no one ever takes a blood pressure medicine for short term, or diabetes medicine, or that sort of thing. And so, again, we're trying to improve that efficiency of the cell. And so we'll work on one function and then turn over and work on another function, and just kind of go down the line there, per the patient's history, of course.
I've been listening to some other podcasts, and I read a book a while back, and it was based on he called it Not Fragile. If you think about this desk I'm sitting at, the more I use it, the more it wears out over time. And so it's fragile. So you would want to like to get it to last a long time, you would be careful with it. But our bodies are the opposite. The less we use our bodies, the faster they break down. The more we use our bodies, the more robust they remain. And I think one of the other things that I'm realizing is when your body has just this regular schedule. I eat at 8 o'clock, I eat at noon, and I eat at 6 o'clock. That's not healthy. And when it starts to run into situations that are unexpected, that's when it starts to jump into gear and do some house cleaning and some upgrading. And so when you talk about typical medicine, take one a day for the rest of your life. But this new type of protocols or therapies, like more unexpected and spurts kind of, I'm fascinated with that. It's like you think about your fasting. What are you doing? You're all of a sudden you're going without for a while. And does it kill you? No, it makes you better.
Yeah, you're breaking that body cycle, because like I tell a lot of patients is they eat healthy, they exercise, but they can't lose fat because their body is in that cycle of not using fat for fuel. So you've got to, I think Maury was the one that used that term. You got to kind of biohack the body into starting to become more efficient and use fat cells for fuel. And so, yeah, no, I think you're absolutely right when you say that. That's exactly what we're trying to get through with our patients. And like I said, it's an ever evolving process. The other thing that I thought was an interesting topic, I just remembered it. It's actually a supplement, but it's actually a dipeptide that's over the counter called L-carnosine. And L-carnosine is crucial for maintaining our muscle in our body. And as we age, L-carnosine can decrease by like 75% as we age. And it's the thought of why a lot of our patients get sarcopenic, or loss of muscle mass, as we age. Lots of factors, but one of the other factors. But this L-carnosine helps with. It's a natural anti-glycator, basically. It which is one of the major processes in our body of aging, and it has shown some of the studies on it have been really favorable in helping the blood flow to the brain, just overall function of the brain. And so, like Dr. Seeds said, that's a few dollars a month supplement that you can get through Amazon that can actually do some real benefit. That was kind of where we were going. Like, if you had a person that did just simply like cerebral lysin maybe 2 or 3 times a year for 30, 45 days, and then use like a Selank C-Max rotating nasal spray. We talked about C-Max and Selank last time and some of their effects. They're nasal sprays. They're inexpensive. They are peptides that you have to prescribe, but they're not expensive. And then, use L-carnosine on a daily basis, 500 milligrams twice a day. That, like I said, you can get through Amazon very inexpensively. That's a great start for somebody on their helping either try to prevent neurologic conditions or early phases of neurologic conditions, or even treating some of these people with, more advanced neurogenic conditions. And then you have these other peptides that you can mix in specialized cases like VIP, like the dihexa. And so it's just it's just really a lot of different tools in your toolbox, but it ultimately still boil back down to, hey, just like we piggybacked off of, you could simply have a person on TA1, Alka-Seltzer Gold, ketone esters, maybe a little CJC up at nighttime. That's a great program for the brain as well. It's just, what are the patient's goals? How do we get there? How do we safely get there? What is a patient willing to do? What is a patient not willing to do? I mean, some patients are willing to use 3 or 4 peptides at a time. Some are not. Some financially can afford it. Some cannot. So I just think that's what's really cool about peptide medicine, is just it's truly thinking outside of the box, trying to take a puzzle and try to, master that puzzle and help your patients to the best of your abilities.
I think that what's interesting to me is that we're always looking for that one silver bullet. So is it reversatile, how do I say that?
Yeah.
Yeah. So if I drink a glass of wine every night, then there's my silver bullet.
Mm-hmm.
I'm done, one and done. But the truth is, there is no silver bullet. And what I like about this peptide medicine is how you take these deep labs, we understand where you are, and then we start to design a unique protocol just for you, and you can measure improvement with those labs, with that true age.
Mm-hmm.
I think, to me, that feels better. That sounds like that would be right, because each person is so different.
Yeah, I mean, they are, and it's a discussion I have on a daily basis with my patients, and luckily I'm attracting more and more patients that think like I do, and which is trying to think outside the box. And I think there's such a growing population that wants to think outside the box as well. And you're absolutely right. There is no one trick to ultimately being healthy. It's all I can do is offer my patients all the things that I can think of that can help them be healthy. They have to then reach into that box and choose their 5, 6, 7, 8, 9, 10 of those things that they think they can actually pull off in their life. There's some things that I know that would be good for me, but I simply don't feel like I can pull them off in my life because of either, I'm just not willing to do it, or maybe I'm not dedicated enough in that way. Diet is probably the one thing I'm talking about the most in for myself. I don't have a bad diet, but my diet is not as good as it should be, and I know that. But I live a busy lifestyle just like you do, and sometimes it gets really hard. And I'm also, as my wife says, I'm an extremely picky eater, so it gets tough. But I try to do as many of these things as I can, and everything adds up. It's like when patients come to me and say, okay, if I do this, how much better is it going to make me feel? And I go, I don't know. I tell my patients all the time, if the goal is to get to Weatherford to Amarillo, that's the goal, is to get to Amarillo. It doesn't really matter how we get there as long as we get there. And so if our goal is to do better, feel better, decrease our biologic age, who cares if this was 50% and this was 10% and this was 3%? There's no way to know these things. It's just, trying to implement as many things as we can, because, I'm in big time horse country where I'm at here, animal country. And I always joke with some of my guys, they'll spend god awful amounts on their truck or their trailer or whatever, but they won't spend money on themselves. And I just think, we have to invest in ourselves if we want to stay quality of life, if we want that, if we want to stay mentally sharp, if we want to stay at the top of our game, these are just the things that we have to do. And thank God that we have this knowledge now to do some of these different technologies.
So I have to confess, since we started having these regular conversations, that you can't participate in these conversations and it not impact how you start to look at what you're doing to your body, right?
Sure.
And so I started doing the intermittent fasting. I started taking the ketone esters. I started taking the Alka-Seltzer Gold. And I've noticed that I sleep better. I noticed that I've lost weight, that fasting's not that big a deal. It's just a decision, more or less. And even when I was on vacation in Mexico, I fasted. I got up and went and exercised on the beach. I did these things that made me feel better about what I was doing with my health. And it's so interesting to me that it's very minimal things that you can begin to do. Intermittent fasting. Try to do the Alka-Seltzer Gold. Let's do a little bit of exercise. Let's get out of breath a little bit. Just little things, but you have to change the way you look at yourself to start to really own those.
Yeah, and what's really cool now is as I'm starting to tell this to my patients more and more, and now with some of these peptides going over the counter as a supplement, we're able to get very basic regimens for our patients that aren't extremely cost prohibitive, but that's really helping the patients. And, I think I've said this to you a few times. I used to just bang my head into the wall whenever I'd fix somebody's hormones, and I'd be so proud because their labs look so good on paper. And then they'd say, I don't feel good. And it's like, oh my God, what do you mean you don't feel good? You should feel great. And now it all makes sense to me. Like, it's not that simple. It's not, the good news is fix people's hormones, get them to eat a little better, get them to exercise. And yes, a vast majority of people feel so much better and they're so happy. But there's more to it than that. It's not that simple. And so it's those patients that want to take that next step, because intermittent fasting, I can't tell how many times I tell patients that, and they kind of like their eyes roll back in their head and they have this look on their face like, there's no way I can go 16 hours without eating. Or my other favorite is, well, I already kind of do that. And I go, well, if you kind of do it, you don't do it. just so that we're clear, because kind of means you're still eating. But intermittent fasting is so simple. I mean, it's something that actually your hunger goes away in the mornings once you've gotten used to it. Like you've already said, you feel better. I personally, when I'd eat breakfast, I would feel a little sluggish and tired afterwards. And I just feel like that all goes away with intermittent fasting. Heck, some days I have to look down and go, oh crap, it's time to eat. I mean, now some days I'm starving to death. Like, I have to admit, Maury's out hunting elk this week somewhere in Colorado, and I've been really busy and I haven't worked out this week like I was supposed to. So I haven't been as hungry because of that. But what I haven't been doing is I haven't been eating more. So at least if I'm not exercising, the intermittent fasting keeps my appetite down. I'm not taking in a ton of calories because I'm not burning extra calories this week. So yeah, I mean, it's just picking these different pieces and figuring out what works for each patient. The main thing for providers is just having these discussions with your patients. I'm really lucky in a cash practice that I have time to talk to my patients, to actually spend 30 minutes with them and kind of figure out. And I think I told you this, it was something I've just added recently in the last 3 months, is just, hey, Steve, what's your health goal? Like, what do you want out of this? Because I'm so used to, as a doctor, trying to get out of it what I want, which many times is, I want to see this on a piece of paper. I want to see this number. I want to see whatever it is. I want to see this body fat. And I'd kind of lost touch with, what does the patient want in all this?
Yeah.
What's their goal? What do they, because you have to keep them engaged, because there's this thing called the honeymoon effect. Like if you came into my office and I told you, Steve, unfortunately you have diabetes today, you're going to be upset. You're going to be really motivated to change your life. But guess what always happens with that? It goes away. It fades. In 3 or 4 months, they're right back to their old habits. And so you've got to have somebody buy in. And how you get them to buy in is you also make them invested in what do they want out of this. I mean, yeah, everybody's going to say, I want to be healthier. everybody says it, not everybody really wants it. And so I think that's a really good way to go about it, is actually, truly figuring out what the patient wants out of the relationship as well.
I think what really helped me, I think education and understanding why we're wanting to do these other things is really important. And what I like about these conversations or listening to Dr. Seeds or the others, when it all comes to the cell, and whatever we're doing is impacting the cell and either helping the cell communicate better, repair itself, or hey, off itself if it's not going to help the body hanging around.
Right.
Then it's like, oh, that's why intermittent fasting is so impactful. It gives the cells time to do house cleaning.
It makes the body basically clean up its messes.
Yeah,
absolutely.
And so
it's so many good things. It's boosting the immune system. It's burning fat cells. It's giving our body energy. It's just it's a fabulous free thing that we can all do.
Listening to the conversation about Alka-Seltzer Gold and how balancing out the alkaline acid aspect of your body is like making it fight off viruses, making it where it fights off the flu in the cell area.
Which is where the infection starts. And so as we talked about the Spanish flu, what was the major treatment, baking soda. And so they were onto something. It's not something like they didn't know what they were doing. They actually were onto something with that. Dr. Seeds was he put that video out about Alka-Seltzer Gold right when COVID was starting to hit, and it got taken down for a bit. But Amazon sold out of Alka-Seltzer Gold because of his video, and it's an amazing product. I mean, it's just baking soda. The reason we like the Alka-Seltzer Gold is just simply because it's easy to do. It's not messy like, when you get baking soda out of a container. But, that intracellular pH is so important. Like I tell physicians, it's not the pH of the blood per se, because that pretty much regulates itself. It's the pH within the cells. And that's where that sodium bicarb helps. And just, again, one more way to make the cells communicate better and are more efficient. And same thing with ketone esters. I had a patient that I had a long discussion with him. Then he emailed me back and goes, "Now, why again do I want to take ketone esters?" And I was like, "Oh Lord, that's like a 15-minute conversation." And so I have created up a little email that I just forward back to him now, so that kind of hit the high points, because it's truly like, okay, I don't think we can do all this in an email.
But it's just food that you don't need to digest, that goes straight to the cells.
Yeah, it's the most pure raw cellular energy that you can get, ketone esters.
And you sleep better and you have more energy. But I think what I really noticed is I was concerned. I was forgetting words. I was forgetting, I was going, now what do you call that? I was kind of grabbing for certain vocabulary words I was wanting to recall. And I was going, is there something going wrong with me?
Yeah.
But those ketone esters, I think more clearly. My recall is way better. I feel more positive and less grumpy too.
Yeah, I've added them in now. I take a dose in the morning. I take a half dose in the afternoon, and sometimes take a half dose in the evening time. I mean, they really, really do help with kind of that afternoon, mid-afternoon brain fog that sometimes we have. No, I completely agree with you. Now that's a good side subject. So that's like a patient that says, okay, I'm using ketone esters for this. What's something else I could maybe try intermittently to help? That's maybe where VIP would come in. That would be something that you could use on top of ketone esters, because your ketone esters, your Alka-Seltzer Gold, your TA1, that can kind of be your baseline, your foundation that you can use all the time, along with intermittent fasting, along with what I believe is good, like a Mediterranean low carb diet. And then, bring in that VIP every few months to try that out, to see how that works. Kind of like you said, I kind of like that term, maybe clean some things up for a bit, and then, and then move away from it and see how you do for a while. And because the truth is most of us don't have the time to do 6, 7 different peptides a day. I mean,
Mhm.
I found that with myself. I'll have all these different things, and I'm like, crap, I forgot to do these 3 things this day, because you get busy and you realize, crap, that's,
Mhm.
because I'm the world's worst about my supplements. Sometimes I'll
Yeah.
forget to do my supplements. I have them all over my desk, my home, because I try to, in my car, I try to keep them in different places so that when I remember I've got them, I just, just like most people in our spots, we're really busy. And, it's not that we're lazy. We just forget. We have so many things going on. So, yeah, no, I think it's all amazing. It's just, again, hopefully this starts a discussion for patients with their providers, and seeking out providers that have this kind of knowledge, and seeing what they can do for them.
Yeah. So if you're listening and this is something you want to talk to your provider about, and maybe you go talk to them, and I know how I would feel. It's like I'm trying to explain it, but the doctor's looking at me a little bit, askance, because, "Well, what are you talking about, Steve?" You can suggest to your physician to communicate with Dr. Kris, and Dr. Kris can help them understand what it is that you're wanting to discuss, or help them know what topics that we're discussing here, because I believe most physicians would love to have this in their repertoire and start to really impact their patients in other ways rather than just the insurance mandated therapies or whatever we want to call them.
I think any physician that's out there that is still is still wanting to learn should be and is interested in peptide therapy. But I will say, providers are human,
Mm,
and sometimes the unknown scares the crap out of them. And
mhm.
physicians, the one thing I caution my patients on is certainly have the discussion, but don't be dissuaded if maybe the conversation doesn't go the way you want it to go with your provider. Because so many providers out there today, and I'm sure I've done this at some point in my career, someone tells them about this therapy and they immediately just go, oh, that's bogus. There's nothing behind that. And it's like, if you really question them, like, where are you getting that info from? And it's like, they don't know. They just don't know about it. And physicians are so conservative by nature that if we don't know, we typically just take the stance that it's bad. It's like I was talking to one of the really great physicians here in the country about this, and he said, he treats a lot of patients in eastern part of the United States, and he said, all the time I send, because he doesn't do primary care. He simply does peptides. He does functional medicine. And then he has them maintain still a family doctor. And he says, all the times I'll send letters, I'll give them my card, tell the patient, give them my card, ask if you have questions, if you want to know more. And he goes, how often doctors actually call? And he's like, never, because he's like, it's like, they say they don't like it, but they don't really want to take the time sometimes to learn about it. And, I have to say, the reason I started learning about all this stuff is because it impacted myself. I've talked about my journey many times, but, I was 33, 34. I was flat out overweight and didn't feel good. And I realized, I woke up and said, if I keep going down this path, it's not going to be good for me. My family history shows that this path is not going to work out in my favor, because so many things are claimed to be genetic when I think it's more just how your family lifestyle is, because many times we take after our parents, our grandparents, and that sort of thing. And that's when I started changing things in my life. And it's just, as I've gone down this path, I learn about new things, and, hopefully that's going to continue over the next 20, 30 years or more.
Well, I think this is an excellent conversation, because I think most of the people that listen, they want to take more control of their health. They want to do the things that are going to offer them more time to be present with their family, be able to hang out with their kids or grandkids, to be more effective at work, to do the things that they would really like to, and not just accept that we're getting old. Getting old is it's on everybody's path, but we don't have to enter it in, just accept that we're going to be tired, that we're going to have achy bones, and that we're going to be just not what we used to be. There is a way to start impacting your health and taking more control. And these are just great little things to help your cells communicate better, and to it's not necessarily medicine even, which is the best thing about this is we're making less peptides, just like we make less testosterone. So how nice to have little ways to signal our body to make more of these things that we need.
Couldn't agree more.
All right. So the research clinic is where Dr. Kris hangs out. The www.theresearchclinic.com. Dr. Kris, where can they email you?
Dr. Kris with a K, so DRKRIS at theresearchclinic.com.
Yeah, and so if you want to talk to your physician, maybe you can reach out and talk to Dr. Kris first and be set up for success with that conversation. If not, your physician is more than welcome. And again, these conversations are intended as educational, and you should always consult your physician before changing your medical program. And this is another great episode of Peptides and Age Management with Dr. Kris Wusterhausen. Dr. Kris, thank you.
Thanks, Steve. Have a great day.
You bet. And that's a wrap.